This is Mike Kavanaugh with KHTY TV News. Tonight, we turn our attention to a hidden crisis in Canada, a loophole in the social work and mental health sectors that has left vulnerable people at risk. Across the country, individuals with only diplomas or certificates in social work and no formal degree qualifications or vetting processes beyond basic police checks are volunteering or working in critical roles for nonprofit organizations. Some of these individuals have their own unresolved mental health issues, and the consequences are putting the very people they are meant to help in danger. In Canada, social workers are not mandated by federal law to be registered, certified, or even monitored in some provinces. This lack of regulation allows individuals with only diplomas or certificates in social work to fill roles meant for highly trained professionals. Unlike qualified workers who hold degrees in social work or mental health, these unregulated individuals often lack the skills, knowledge, and ethical training required to navigate the complexities of mental health and disability care. Many nonprofits, desperate for volunteers or low-cost labor, unknowingly or willingly accept these individuals without conducting proper background checks, training, or oversight. These practices leave vulnerable people, such as those with mental health issues, developmental disabilities, or trauma histories, exposed to potential harm. The dangers are clear. Unqualified individuals who lack proper training and oversight often bring their own biases, prejudices, or unresolved personal issues into their roles. In some cases, volunteers have been reported to discriminate against individuals they personally dislike, creating a hostile environment for those seeking help. Imagine a person with a mental health condition or disability being turned away, dismissed, or even judged by the very people who are supposed to support them. This can lead to further trauma, isolation, and a breakdown in trust with the organizations meant to help. These nonprofits, while often well-intentioned, become a risk to the very populations they are supposed to protect.
I went to a nonprofit for help with my depression, said a client who wished to remain anonymous. But the volunteer I met didn't seem to understand my condition at all. They dismissed my concerns and even implied I wasn't trying hard enough. It made me feel worse than before I went in.
Experts agree. Canada must implement stricter regulations to ensure that anyone working in social work, mental health, or disability services is fully qualified. A simple certificate or diploma is not enough. Professionals must hold relevant degrees in social work, mental health, or related fields, and be trained under the strict supervision of experienced social workers before they can work with vulnerable populations. In countries like Australia and the United Kingdom, social workers are required to register with professional councils, undergo extensive training, and adhere to strict ethical guidelines. In Canada, however, the lack of a cohesive nationwide system means that unqualified individuals can slip through the cracks, putting people at risk. Canada needs mandatory registration with professional councils for all social workers in all areas of work, whether at work, in nonprofits, or voluntary positions. All social work must require at least master's degree levels in social work, mental health, disability and trauma care, and related fields with no exceptions. All social work in nonprofits and non-formal healthcare environments must be strictly supervised underqualified professionals and have ongoing monitoring and recertification for licensing annually. The lack of regulation in Canada's social work sector is garnering increasing attention. Advocacy groups are calling on the government to mandate that all social workers, both paid and volunteer, be formally trained, registered, and monitored. This reform is not just about protecting clients, it's about ensuring the integrity of Canada's mental health and disability services. Vulnerable populations deserve to be supported by trained professionals who are held to the highest ethical and professional standards. Advocates argue that without these changes, Canada risks further eroding trust in its nonprofit sector and failing those who need help the most. The time for reform is now. This is Mike Kavanaugh with KHTY TV News. The safety and dignity of vulnerable populations must be Canada's priority. Unqualified social workers and volunteers pose a significant threat, but with the right reforms, We can build a system that truly supports those in need. What do you think? Should Canada mandate stricter regulations for social workers? Share your thoughts in the comments below, and don't forget to like, subscribe, and stay tuned for more investigative reporting. Thank you for watching.